Hey guys, Dr. Dadvand here, board certified plastic surgeon located here in Los Angeles. Welcome to my YouTube channel where I focus on breast and body surgery with a specific focus on gynecomastia and FTM top surgery. So today I want to talk about a big subject in top surgery, and that's scars. Now, I'm referring here specifically with the double mastectomy scars, not the keyhole or the periareolar. And this is a big deal because the scar, and the final scar, is really a lot of the outcome and how good the patient looks. So I want to first talk about just general healing and scarring, and then talk about what I do in my practice for my patients. So the first thing I want to talk about is the difference between an incision and a scar. An incision, in my opinion, is what you see immediately and in the first few weeks after surgery. It's a nice thin line. It's really before the body's had a chance to react to the surgery. A scar comes later over the next few months and up until the first year or two, and that's the body's reaction to the surgery. So in this patient, you can see this photo was taken at around a month out. It's a very nice thin line. The body hasn't reacted to this surgery yet. And I'm going to show you throughout the rest of this video the same patient at different points in time so you can see how this patient's scar matured over the first year. So in the first month, the incision looks pretty good. It's a nice thin line, but between months 1 and 6 is when the body's really starting to react to the surgery. It's a very inflammatory phase where the body's pulling down collagen, breaking it up, laying down more collagen, breaking it up, and you start to see the impact on the scar itself on the patient. And this is a patient here now, same one, at around 3-4 months, and you can see the differences in the scar compared to the one at 1 month. So after that initial 6 months, the level of inflammation really goes down. However, the body's still working on that scar. It's maturing, and by that I mean it's getting softer, it's getting lighter in color, but this process can take a few years to get to the final result. But that doesn't mean we don't do anything about it. We can do things at that point to really affect the final result, and I'll talk to you about that in a little bit later in this video. So how do I approach scars in my own practice, in my own patients? I'm a real proponent of scar therapy and scar management. Starts very early on, a few weeks after the surgery, and I'm a big proponent of starting with tape and keeping that tape to leave the tension off the incision to prevent widening. Widening is the most important thing to prevent in the first 4 to 5 months after surgery. After that, then we deal with color. But I have my patients start taping really after their surgical tapes come off, which for most patients is by 3 weeks. They'll continue taping then for about 2 months with a specific type of tape called HipaFix, and then I switch them to a silicone tape after that for up to 6 months total. So I really encourage patients to tape because it really does, in my opinion, help the final, not just color and thickness of the scar, but also the width. The width is the most important thing because I can flatten a scar that's raised. I can't make a wide scar narrower without surgery. Another thing that I really stress upon patients in that first several months after surgery is something referred to as T-Rex arms, meaning like don't raise your arms up, don't do a lot of extraneous activities with your arm over your head. Why? Well, it's common sense because when you do this, it actually puts tension on the incision and that scar will gradually widen with repetition of that movement. So I have my patients for the first 4 to 6 months minimize that as much as possible. And even when I let them start exercising at around 6 weeks, I don't want them doing any exercises where their arms are going above their heads to minimize that widening of the scar. Like I said before, I can make a thick scar flat without surgery, but I can't make a wide scar thin without having to do another surgery. So in my practice, I'm a big proponent of tapes, and that's because number one, it does mechanically take the tension off the incision for those first few months, but also it's a lot easier for patients to be compliant as compared with oils or gels. Gels, you got to remember to put it on a couple times a day. You got to wait for it to dry before you put your shirt on. Sometimes the gels flake off with exceptional movement, and so tapes don't do those things. I like tapes because they're easy for the patient and they work for the most part. So to summarize this huge topic of scar therapy in top surgery, number one, Everybody heals differently. Number two, not every product works the same on each patient. So in my practice, I have two basic tenets. One is to control the arm movement for the first 4 to 6 months, so no heavy raising the arms to keep the width of the scar as minimum as possible. And then number two, to use a scar therapy. I prefer tapes and silicone tapes. Other patients might do better with oils or topicals, but doing some form of scar therapy is very important for the final outcome of your scar. Now, I haven't even mentioned things like laser therapy and scar camouflage tattooing, but that's a topic for a different video. So I hope you guys found this video informative, but if you want more information on top surgery, be sure to visit my website, my IG, my TikTok, and as always, my YouTube channel. Until next time, guys.